Now let's learn about the abducent nerve. So the abducent nerve is the sixth cranial nerve and it is supplying the lateral rectus muscle. Okay, LR6. So look at this course here. So as you can see, the abducens nucleus is giving the abducens nerve in the pons. Okay, and after exiting from the pons, the abducent nerve passes a long course through the subarachnoid space. The abducent nerve has the longest intradural course. Okay, so the intradural course is longest for abducent nerve, and after that it passes through the cavernous sinus. Okay, it is passing through the center of the cavernous sinus along with internal carotid artery. Okay, it is a content of the cavernous sinus along with the internal carotid artery, and after it exits the cavernous sinus, it passes through the superior orbital fissure through the common tendinous ring. Okay, and after it enters the orbit, it supplies the lateral rectus muscle. Okay, so the course is, it comes from pons. Okay, so the sixth cranial nerve, that is the abducent nerve, comes from pons and it passes inferolateral to the internal carotid artery through the cavernous sinus. Okay, and from there it passes through the annulus of Zinn within the superior orbital fissure and supplies the lateral rectus muscle. Okay, so what happens in a lesion of the abducent nerve? So remember that the abducent nerve is the first nerve to be affected when there is cavernous sinus thrombosis, because it is a direct content of the cavernous sinus. Okay, so when there is lesion in the abducent nerve, the lateral rectus will be affected. That means the lateral eyeball movement is affected. That means there is unopposed movement of the medial rectus. So there will be medial squint. Okay. So ipsilateral lateral rectus paralysis is present. It leads to unopposed medial rectus function, leading to a medial squint. Okay. So look at this diagram here. So this eye is affected here. So that means this eye, here the medial squint is present. That means the medial rectus is functioning unopposed because the lateral rectus is paralyzed and therefore unable to move the eyeball to the lateral side. Okay,